Senator Kelly.
Thank you, Mr. Chairman. General Friedrichs, good morning, and thank you, all of you, for being here today. General Friedrichs, in a recent war game brief to Congress in November of 2024, a hypothetical conflict in the Indo-Pacific resulted in 3,000 U.S. casualties in 3 weeks and 10,000 across the entire conflict. And I'm kind of following up on Senator Budd's line of questioning here. These numbers are higher than anything we've seen since the Korean War. And as severely injured service members transition through the care system and make their way back to the United States for treatment, I'm concerned that the number of DoD providers capable of handling trauma will be grossly insufficient. So given that, we're going to need to surge capacity, potentially found in the U.S. hospital system and VA hospitals, so meaning civilian hospitals, VA hospitals. What concerns do you have with relying on U.S. civilian and VA hospitals to provide this trauma care to our service members?
Thank you very much, Senator Kelly. And I'd start by saying, even before we get patients back to the United States, in the past, we've relied on our allies and partners to help care for our casualties. And I am deeply concerned if we sever or degrade those relationships, we will need to rewrite our plans, and the demand on the U.S. healthcare system will be even greater. To your point about the U.S. healthcare system, the Integrated CONUS Medical Operations Plan that we updated in 1998 and then didn't look at until 2020 is the plan that describes how we will surge capacity. But a key part of that gets back to some of the discussions we've had earlier. There have to be doctors and nurses and pharmacists and all the other staff to do that. And I implore that we continue to look at the pipelines that produce those medics as well as the facilities in which they work. We had briefly chatted about the opportunity for a medical equivalent to the civilian reserve air fleet that we use to ensure access to civilian aircraft when needed. I believe we need some similar construct in the healthcare system where we partner with industry and recognize that during surge moments, there's a plan and there's money available for us to be able to leverage their staff and their facilities.
Is there a plan?
There is a plan. We wrote the first version of that before I retired, and they are working on an update to that. But it would benefit from additional congressional oversight to ensure that it's on track and it does not get diverted by bureaucratic buffoonery.
Are there current efforts in the relationship building with these hospitals?
The Defense Health Agency is tasked to have that outreach, and as I've met with hospital CEOs and system owners, there's certainly an opportunity to do more in that space. We must view the healthcare industry the same way we view the aviation industry or the missile-producing industry, as our partners. We cannot take care of America's casualties without those partners.
Could you talk to the value in the 2 Navy hospital ships? I don't know if anybody here is prepared to talk about, because I think there's enough effort underway to replace those. There's also the training ships for the state maritime academies that I think also could serve a role. I visited one at the Philly shipyard a few weeks ago, had an operating room on board. Is that part of the system as you envision it?
Yes, absolutely. The hospital ships are integral to our plans for a large-scale combat operation, and the 2 ships we have are some of the oldest ships afloat. They have to be replaced.
I think there's a plan to replace them now. It's can you speak to how that is going, if you know?
So I pushed incredibly hard for that plan as the Joint Staff Surgeon against intense opposition that we should spend the money in other places. I would defer to the Navy for the latest update on it because they can give you the most current plan. But my understanding is that we're still years away from having the replacement ships available. So we'll have to extend the current ships. And I believe the last update I received, which is dated, was through 2035. But we do need that additional replacement funding to replace those aged ships.
All right. Thank you, and thank you, Mr. Chairman.